know it's state and local leaders that this is helping give them what they need to plan and get vaccines administered more quickly. But we know it's not only the amount of vaccine that matters. Another critical component is creating easily accessible places for Americans to get vaccinated. Millions of Americans turn to their local pharmacies every day for their medicines, flu shots, and much more. And pharmacies are readily accessible in most communities, with most Americans living within 5 miles of a pharmacy. That's why we're pleased to announce our first phase of the federal retail pharmacy program for COVID-19 vaccinations. This is a key component of President Biden's national strategy, offering vaccinations in America's pharmacies. Starting on February 11th, the federal government will deliver vaccines directly to select pharmacies across the country. This will provide more sites for people to get vaccinated in their communities, and it's an important component to delivering vaccines equitably. This pharmacy program will expand access in neighborhoods across the country so you can make an appointment and get your shot conveniently and quickly. But I wanted to set expectations appropriately. Due to the current supply constraints, this will be limited when it begins next week. In this first phase of the program, supply will be at only about 6,500 stores nationwide before expanding. And in the early phase, many pharmacies across the country will not have vaccine or may have very limited supply. People should first make sure they meet their state's eligibility requirements for vaccinations, and then check availability on their local pharmacy's website. Equity is at the core of how the Center for Disease Control is working with states to select pharmacy partners for this first phase. Sites are selected based on their ability to reach some of the populations most at risk for severe illness from COVID-19, including socially vulnerable communities. And the CDC will monitor the data on an ongoing basis to make sure that pharmacies are efficiently and equitably administering vaccinations. This initial phase of activating local pharmacies will get more shots in arms and will ensure that pharmacies have the infrastructure and the experience they need to scale up when vaccine supply increases in the months ahead. Eventually, as we're able to increase supply, up to 40,000 pharmacies nationwide could provide COVID-19 vaccinations. These are places ranging from local independent pharmacies to national pharmacies and supermarkets. This is a critical step to provide the public with convenient, trusted places to get vaccinated in their communities.